Oh, hello there. Take a seat, make yourself comfortable. I'll be with you in a second, okay? Right. Could you just tell me your name? Okay, that's perfect. And your date of birth, please. Thank you. Alright. Okay, so let me just have a little quick last look through the paperwork. Thank you for getting here on time. I've had a few people cancel today due to the weather. It's terrible, isn't it? It's so windy and wet out there. Okay. Right, so you're here for me to give you a physical exam for your new job. Okay, congratulations on your new job. My name's Dr. Sarah, and I'm going to give you a thorough examination. Okay, I need to check all the relevant things that your employer wants me to check. Okay, it's a pretty standard medical examination, all right, for occupational health. Okay, nothing to worry about. I just need to ask you a couple of questions first, if I may. All right. Okay. So, are you on any current medications? No? Okay. Do you suffer from any allergies at all? Okay, hay fever. All right. Okay. Have you had any operations at all, recently or in the past? Okay. So you had an appendectomy. Do you know how long ago that was? Okay. Alright. That's fine. Okay. And do you have any current medical conditions that you're concerned about? No. Okay. Do you suffer from headaches at all? Only occasionally. Migraine? No. Okay. Well, my assistant checked your weight and height, and your BMI is absolutely fine, so that's a good start. Okay. Do you do any exercise regularly? You like walking? Okay, that's fine. And cycling? Okay. Do you smoke? No? Okay. Alcohol? How much? Okay. And I have to ask you this, any recreational drugs at all? Okay. All right. Okay. Well, things are looking good so far. Right. I'll pop that down there. I'm just going to pop some gloves on. And I'll begin the examination. Okay. I'm going to do your blood pressure first, if I may. Okay. Alright, you've had this done before, haven't you? I'm sure. Yeah, okay. So, I'm just going to pop the cuff onto your arm. Hold out your arm for me. Thank you. There we go. And I'll pop that on there. Okay. I'll put my stethoscope in so we can have a listen. Okay. Alright then. Okay, so I'm going to be pumping up the armband. It's going to go tight, okay. There we go. Are you comfortable there? Alright. Okay, just going to pop the stethoscope onto your arm. There we go. And let's get pumping that up. I will check it on the other side as well. There we go. Just try it on your right arm now. Okay. Get this ready. Okay. You okay there? Good. That's wonderful. There we go. Let's pop that down there. We won't be needing that again. So let me just make a note of your blood pressure. Okay, so that was 117 over 81, which is absolutely fine. Okay. I'll just have a little listen to your heart if I may. Okay. Just going to pop this onto your chest. Alright. Breathe normally for me, thank you. Okay, and let's have a listen to those lungs, okay? Just breathe in deeply and out. Okay. And again, in and out. Okay, and one more time. Okay, I'm just going to pop this just onto your neck. Alright. That's perfect. There we go. Let's pop that down there. It's all good. Okay. Just check your oxygen sats, okay? Just pop this onto your finger. Okay. Just pop out that hand, lovely. Thank you. There we go. Just tell me how much oxygen is flowing through your blood and your pulse rate as well there. Okay, that's wonderful. Your oxygen sats are at 99, so that's wonderful. And your pulse is at 68, which is fine too. Checking out well so far. Are you comfortable there? Good, good, good. Okay. So, I'd just like to have a little check inside your ears if I may. Alright. And for that I'm going to be using this otoscope. Okay. It's a fresh chip, I just put one on before you arrived. Okay. And I'll just insert the otoscope gently into each ear and have a little look around. Okay, tell me if anything feels uncomfortable, won't you? Alright. Okay. Keep nice and still for me. Alright. There we go. Right, I'm just going to pull up and back on your ear a little bit and insert that gently. There we go. Is that okay for you? Alright, so I can now see the ear canal, which looks absolutely fine. It's not red, there's no swellings. That's perfect. Eardrum is clear, normal amount of earwax. That's wonderful. Okay, just reposition that a little bit there. Okay. Everything looks absolutely fine. There's no bulging of the tympanic membrane there, no wrinkling, no fluid. Perfect, no infection. Okay, I'll gently withdraw that now. Okay. Well done. Was that comfortable? Okay, let's do it on this side. Okay. Just pulling up and back gently. Okay, there we go. Just inserting that now. Okay. So your ear canal is fine. Again, normal amount of wax, no redness, no dry skin. Perfectly visible tympanic membrane with no unusual features. I can see the structures behind. Okay, should be positioned a little bit. Okay. There we go. That's absolutely wonderful. No problems there. You've got very healthy ears. I'll just withdraw that gently. Okay. Okay. I'll just change the tip on the otoscope. And I'm going to have a little look up your nose if I may. Okay. This won't hurt, just might tickle a little. I'll just raise your nostrils slightly, alright? Okay. Nice and still for me, thank you. Okay, and just insert that up. Alrighty. Okay, that looks fine. Looks fine. To the side. Okay. Alright. There we go. It's not the most comfortable thing, is it? But all done now. Okay. So, just going to have a little press over your face there. Is there any pain or tenderness over that area there, the sinuses, or at the top? No? Okay. Okay. Little feel of the lymph nodes now, just down the neck. Right. Just behind your ears. Behind your neck there. Just underneath. Okay. That all feels fine. That didn't feel sore at all, did it? No? Okay. Alright. Just going to take a little look in your throat, alright? Just use this light here. Okay. Just going to lightly depress your tongue with this. I won't push it too far back. I don't need to make you gag. Alright, then open nice and wide for me. There we go. Perfect. Just coming in with my light. Okay. Can you say R for me? Lovely. Okay, could you just pop your tongue to the roof of the mouth? Okay. To the left. To the right. Okay there. Okay, just going to use this one more time. Okay. And say R one more time for me. Okay, that's all good. Wonderful. You don't normally get problems with your throat, do you? No. Okay, that's perfect. Okay. Right, so I'm happy with that so far. Next part is the eyes. Do you have any problems with your eyes normally? Do you wear contact lenses or glasses? Okay, only glasses for close-up. Alright, that's fine. Okay. So I'm not going to be doing an eye test as in-depth as your regular optician would, okay? I'm just going to take a little look around the eyes, okay? And just get you to do a few little eye movements and just do a very basic visual acuity test with the Snellen chart. Okay? Good, alright. Give me 2 minutes and I'll be back with the chart. Okay then. So this is the Snellen chart, alright? So could you just cover your right eye for me? Okay. And can you read down the list there for me? As far as you can go. Okay. Brilliant. Okay, can you read that one there? Yep. There. Wonderful. Can you read anything on these lower lines? That's perfect. Okay, so could you cover the other eye instead now, please? Okay, and we'll do that again. Okay, start from there. Okay, wonderful. Yeah, okay. What about there? Okay. On the bottom line. Wonderful. And that colour there? Perfect. Okay. Okay, let's have both eyes uncovered now. Okay. And can you read the bottom line there? Okay, that's fine. Just pop that down there. Okay. So I'm just going to have a little visual inspection around the eye, okay? You say you don't have any problems, so I'm not expecting to find anything. I'm just going to lift your lids up if you'd just like to look down for me. Okay, so just, there we go, look down. Okay, it's going to pull them down there. Could you look up for me? Okay, it's going to come a little bit closer. Just have a look around. A little press around the skin on each side. Okay. Okay. Close your eyes for me. I'm going to hold them and I want you to try and open. Okay. That's perfect. Alright. Okay. Just going to check your pupillary reaction briefly. Okay. Just look straight at my nose. Okay. Don't look at the light. Just look straight at my nose. Okay. And in there. Okay, that's fine. Okay, and I'm going to bring a finger in from one side. Can you tell me which side and when you see it? Okay? Okay. 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 Alright, perfect. Okay. Could you just look right behind me? Okay, and now look at my finger. That's wonderful. No problems there. Okay. Could I just take a little look at your hands? Okay, thank you. Just going to check the capillary refill, make sure that the blood flow is good to your fingers there. Alright, so I'm just going to press the end of your fingers. Okay, just inspecting your nails. Okay, just turn the hand over for me. Okay, that's fine. Let's take a look at this right hand. Thank you. Okay, I'm just going to check that capillary refill. Okay. Check the nails. And just turn the hand over for me. Thank you. Okay. That's all good. Okay. I'm just going to have a little look at your skin in general. I'll have a little look around your face. Okay. Is that all right? Okay. Just keep nice and still for me. Just going to have a little look. To gently just press around a little. Have a feel through your hair. That looks fine. Let me just take a look at your arms, alright. Your skin looks very good. You've never suffered with eczema or anything, dermatitis? No? Okay, just look very clear. Okay, look at this side. That looks wonderful. Okay. Now, you brought your intestine with you, haven't you? Perfect. Okay, have you got that with you now? Okay. Right, wonderful. Let's just have a little look at that at the light. Okay, so that's pretty clear, so that's good. Okay. I will use just a little dipstick. Just to check it all. Okay. A little bit of tissue. There we go. I'll be needing that. This is a first of the morning sample. That's always the best. Okay. So let's just dip that in there. Okay. You won't be needing this, will you? Okay. Right, let's just have a look. Got all nice pretty colours. Let's just have a look. So, leukocytes, fine, they're white cells, okay. Nitrates, okay. Protein, there's no protein, so that's good. pH is normal. No blood present, that's fine. Okay. Specific gravity is fine. No ketones, bilirubin, good. There's none of that present, and there's no glucose. So there's nothing in there that would concern me and that would want me to get a further laboratory urine test done. So that's fine. Perfect. Let me just write you down as normal there. Okay. Right. Now, I'm sure you may have seen one of these before. It's a reflex hammer. Okay. So I'm just going to be checking some reflexes on your arms and legs. Alright? It might feel a little bit strange, but it won't be painful. Okay. Alright, so let's start with this right arm. Just let your arm go really floppy for me and I can take the weight of your arm. There we go. Okay. Okay. Alright. Okay. Wonderful. Let's try this side. Okay. Nice and floppy for me. just going to move down just for your knee, okay? So let's just move that knee a little bit there. I'm just going to give it a tap, alright? That was a good one, wasn't it? It jerks forward quite a bit. Okay, this leg now. Wonderful. And just down at your ankles. Okay. That's really good. Okay, so all good there. Okay. The next part, I just want to check your sense of touch, okay? How you perceive it. So, what I've got is a little needle, okay? I'll just touch that there. It's not too bad, it's sharp, but it's not painfully sharp, okay? And some cotton wool, okay? So I want you to close your eyes and I want you to tell me if what you feel is sharp, or soft. Okay, close your eyes. Okay. Okay. Okay, perfect. Okay, and on your arms, could you feel this? Okay, could you feel this? Does it feel the same on both sides? Good, okay, could you feel this? This, okay, this, and this. Does it feel the same on both sides? Okay, that's fine. Okay, just going to do it on your leg. So, sharp or soft? Okay, perfect. Sharp or soft? Okay, wonderful. Okay, could you feel that? Could you feel that? Could you feel that? And can you feel that? Okay, same on both sides? Wonderful. Okay, that's perfect. Okay, so I am needing to do a little blood draw from you because we do need to get a general blood count. Okay, run on your bloods. Is that all right? You okay with that? Right. Okay. Just relax for a second. I'll just get the things ready. Okay. All right then. Okay. So let's just have a little look at these veins. See which is the better arm. Okay. Is there anything that you know is better? Left or right? Okay, let's have a look. Both sides look good. Any preference? Okay, we'll try your right side. I'm just going to pop this tourniquet on. Okay. Okay, nice and tight round your arm. Could you just make a fist for me as well? Just relax the arm out there. That's perfect. Okay. I'm just going to have a little tap around and press to make sure I can feel where I'm going to go in there. Alright. Oh, that's perfect. So you'll feel just a sharp scratch. Okay. Alright, you don't have a look if you don't like it. Alright. Okay. There we go. So I'm just going in now. Alright. Pop that bottle. Okay, here we go. Sharp scratch. Well done. You alright there? Good. Just need a few little bottles, okay? They're only tiny. Right. Okay, it's the second one. that tourniquet off now. There we go. Doing great. Okay, one more bottle. Okay, last one now. Okay, that's great. Well done. Okay, just can hold that cotton wool on there for me. That's perfect. Just press on nice and firm for a little while. I'll just sort these out. Okay, that's perfect. Okay, let's have a little look at that now. Take that off. Oh, all good. Well done. Okay, I'm going to pop a little dressing on there then, so you don't leak everywhere. No, you're not leaking, you're fine. Wasn't that bad, was it? No. Okay. Just put a little plaster over that. Okay. There we go. There. Wonderful. Right, so that's the buds. Okay. Alright. Just like to check your sense of smell, if I may. Okay. So can you just block off one nostril for me? Block your right one off, okay? I'm going to ask you to smell the contents of this bottle. Okay. There we go. Tell me what you can smell. Citrus, yes. Any particular type? Well done, yes, it's lime. Very well done. It's a beautiful smell, that, isn't it? Okay. So let's check the other side. So could you just block the other nostril? Okay. Alright. There we go. That's lavender. Perfect. There. No problems there. Okay. So you're checking out really, really well. I just want to check a little bit about your mobility and strength, if I may. Okay, so I'm just going to grab your arms, put your arms like that for me, okay? And I'm going to pull, okay? And you try and pull me back towards you, all right? Wonderful. Okay, I'm going to push and you push me. Oh, okay, nice and strong there. Okay, can you grip my hand? Yeah, ooh, that's a firm grip. And this side? Okay, that's wonderful. Okay, I'm just going to place my hands gently onto your shoulders. Could you just shrug up for me and push as hard as you can? That's wonderful. Okay, so I'm going to place my hand on this side of your face, okay, and turn your head into it as I push. Okay, same on this side, turn into my hand and try and push back. That's great, that's great. Just with your legs, I'm just going to pull up, okay, towards me, and you try and pull your legs back, okay? Wonderful, I'm happy with that. It's just a basic check, okay? Alright. And the last thing I'd like to do is just a little hearing test, okay? We do have the facilities to do a proper hearing test with headphones where you press the button and when you hear beeps, okay? This is just going to be a very basic test. Alright, so I'd like you to just close your eyes for me and tell me what side you can hear this, okay? I'll be my gloves rustling, okay? Close your eyes, okay? Okay, and now eyes closed for me, and I'm going to rustle my gloves again, okay, but I'm going to move my arm away from you. Tell me when you can no longer hear it, alright? Okay, we'll start with your left ear. Okay, and now your right ear. Okay, that's wonderful. I'm just going to whisper a few little things into each ear and I want you to repeat them to me. Alright, I'll start with your left ear first. Okay, you can open your eyes now. Okay. Cat. 24. Pocket. Perfect. And on your right side, monkey. 71. Apartment. Very, very good indeed. So, doesn't seem to be any problems with your hearing there. Okay. Okay. Right. Last little test now. Do you ever have any tummy problems at all? Just a little bit gassy now and again. Okay, well that's perfectly normal. I'm just going to have a little press around the abdomen and then we're done. Okay, so just relax there. Don't tense any abdominal muscles at all. Alright, so I'm just going to have a little palpate around. Okay. Okay. Tell me if anything does feel uncomfortable. Okay. I'm just going to push a little bit deeper now. Okay. Alright, okay. I'm just going to have a little tap. Okay. Wonderful. Absolutely perfect. Okay, well, I'm going to sign you off as having a perfectly clean bill of health for your new role. Okay. You start the role next week. Yeah, wonderful. So I'll write a little report over and that will go over to the employer. Okay. And that'll be with them probably later today or tomorrow. Alright, it's all done electronically these days. Okay, but absolutely fine. I've got no concerns whatsoever with you. Okay, nothing to worry about. Have you got any questions for me? Okay. That's fine. That's fine. Yeah, there will be annual checks, and if there are any checks that are specifically needed for your job, should you move position, okay, they will also refer you back to me. Okay, and if you do start to spend a lot of time on a computer, your eye test costs are covered. I do know that. Okay, but they'll tell you more about that. You get vouchers, alright, and you can take them to an optician to get the eye tests free, and there's a contribution towards glasses as well. Yeah, so it's not all bad. Alright then, so it's been great seeing you today. Enjoy the rest of your day. Okay, take care. Bye bye.